Do you feel like you're walking on pebbles? Maybe it feels like there's a marble stuck in your shoe that you just can't shake out. If you're experiencing pain in the ball of your foot that just won't go away, you're definitely not alone. My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas. I've been treating patients with foot and ankle problems for over 25 years, and ball of foot pain is one of the most common complaints I see in my practice every single day. In today's module, we're starting a comprehensive series called Ball of Foot Pain 101. This first episode is all about understanding why the ball of your foot hurts and what your body is trying to tell you through that pain. By the end, you'll have a clear understanding of what's happening in your foot, what might be causing your discomfort, and most importantly, what you can do about it right now. Before we get into the details, I want you to know that I've written a comprehensive book all about ball of foot pain that covers everything we'll discuss today and much more. You can get it completely free at www.balloffootbook.com. Also, if you find this information helpful, please like this video, hit the subscribe button, and share it on social media. This helps others who are struggling with foot pain find the relief they need. Let's start with the basics. What exactly is the ball of your foot? The ball of your foot is that rounded area just behind your toes where your metatarsal bones meet your toe bones. Think of your foot like a tripod with three main contact points: your heel, the outer edge of your foot, and the ball of your foot. When you walk or run, these 3 points work together to distribute your body weight and help propel you forward. The ball of your foot contains 5 metatarsal heads. These are the rounded ends of the long foot bones. Between your skin and these bones, you have a natural fat pad that acts like a built-in cushion. This fat pad is absolutely crucial because it absorbs the tremendous force that goes through the ball of your foot with every step you take. When you're walking normally, the ball of your foot can experience forces up to 3 times your body weight. When you're running or jumping, that force can even be greater. Now, when something goes wrong in this delicate system, every step can become painful. The pain you're feeling isn't random, it's your body's way of telling you that something needs attention. Let's talk about the most common causes of ball of foot pain so you can start to understand what might be happening in your specific situation. The first and most general cause is something called metatarsalgia. Now, metatarsalgia isn't really a diagnosis, it's more of a description of your symptoms. It literally means pain in the metatarsal area. This type of pain usually develops from overuse and excessive pressure in the ball of your foot. Think of it like this. If you repeatedly put too much pressure on any part of your body, it's going to become inflamed and painful. The same thing happens in the ball of your foot. Metatarsalgia often develops when there's an imbalance in how weight is distributed across your foot. Maybe you have a high arch that puts extra pressure on the ball of your foot. Maybe you've been wearing shoes that don't fit properly. Or perhaps you've increased your activity level too quickly without giving your feet time to adapt. Whatever the cause, the result is inflammation and pain that can make every step uncomfortable. The second common cause is capsulitis. This is a condition I see frequently, especially affecting the joints behind the second toe. Around every joint in your body, there are ligaments that provide support and stability. In the ball of your foot, these ligaments form what we call a joint capsule. When this capsule becomes inflamed, that's capsulitis. Capsulitis often feels like you're walking on a marble or small rock. The pain is usually very localized, right behind one specific toe, most commonly the second toe. What makes capsulitis particularly concerning is that if it's not treated properly, it can progress to a more serious problem. The persistent inflammation can actually cause the supporting ligaments to weaken and even tear, leading to toe deformities that may require surgical correction. The good news is that we have advanced regenerative treatments that can now help capsulitis naturally. Treatments like platelet-rich plasma therapy, or PRP, use your own body's healing factors to reduce inflammation and promote tissue repair. These treatments can often prevent the progression to more serious problems when used early in the condition. The third cause I want to discuss is fat pad atrophy. Remember that natural cushion I mentioned earlier? Well, sometimes that cushion starts to thin out. This can happen naturally as we age. It's one of those unfortunate facts of getting older, but can also happen from repetitive, high-impact activities, from wearing high heels for extended periods, or even from previous steroid injections in the area. When your fat pad thins out, you lose that natural shock absorption. Suddenly, you're walking more directly on the bones in the ball of your foot. Patients often describe this as feeling like they're walking on bone or having deep aching pain that's worse on hard surfaces. For fat pad atrophy, we now have innovative treatments like fat grafting procedures that can actually restore the natural cushioning in your foot. We can also use regenerative therapies to help to improve the health of the remaining fat pad tissue. Finally, I want to give you a preview on something we'll discuss in more detail in our next module, Morton's neuroma. This is a condition where the nerve tissue behind your metatarsal bones becomes thickened and inflamed. It most commonly occurs between the third and fourth toes. The pain from a Morton's neuroma is usually described as burning, tingling, or numbness that can shoot into your toes. Most patients tell me it feels like there's a pebble in their shoe, but when they check, there's nothing there. For Morton's neuroma, we've seen excellent results with non-invasive treatments like extracorporeal shockwave therapy. This treatment uses acoustic waves to stimulate healing and reduce inflammation in the affected nerve tissue. Many of my patients experience significant pain relief without the need for surgery. Now, how do you know which of these conditions might be affecting you? Your body gives you clues through the type of pain you're experiencing and when that pain occurs. Location is a huge clue. If your pain is localized to one specific spot, particularly behind your second toe, capsulitis is a strong possibility. If the pain is more generalized across the entire ball of your foot, metatarsalgia is more likely. If you're experiencing burning or tingling that shoots into your toes, a Morton's neuroma should be considered. The timing of your pain also tells a story. If your pain is worse when you're walking barefoot on hard floors, that often indicates a fat pad problem or general metatarsalgia. But if your pain is worse in tight shoes but better when you're barefoot, a Morton's neuroma is more likely. If you have pain that's constant regardless of shoe or activity, capsulitis or a more serious structural problem might be the culprit. Pay attention to what makes your pain better or worse. Does it hurt more in certain shoes? Is it worse after you've been on your feet all day? Does it hurt when you first get out of bed in the morning? All these details help to paint a picture of what's really going on. The good news is that there are things you can do right now to start getting relief while you're figuring out the exact cause of your pain. First, consider activity modifications. I'm not saying you need to become a sedentary, but if certain activities are making the pain worse, it's okay to take a temporary break from them. If running on concrete is causing problems, try switching to a treadmill or a track with more cushioning. If standing all day at work is the issue, see if you can take more frequent sitting breaks. Avoid walking barefoot on hard floors. I know this might seem like a small thing, but it can make a huge difference. Hard surfaces like tile, concrete, or hardwood floors provide no cushioning for the ball of your foot. Even just wearing supportive slippers around the house can help reduce your pain. Second, try some simple padding solutions. You can find metatarsal pads at most pharmacies. These are small cushions that you place in your shoes just behind the ball of your foot. They work by redistributing pressure away from the painful area. Cushioned insoles can also provide some relief by adding a layer of shock absorption. When you're choosing shoes, look for ones with adequate cushioning in the forefoot area. Avoid shoes that are too tight across the ball of your foot. Be especially careful with high heels, which can dramatically increase pressure in that area. However, I want to be very clear about something. While these measures can provide temporary relief, they're not addressing the underlying cause of your pain. If your symptoms persist for more than a few days, or they're interfering with your daily activities, it's time to get a proper evaluation. There are certain symptoms that should never be ignored. If you have persistent swelling in the ball of your foot, that can indicate a more serious problem. Sharp shooting pain that doesn't respond to rest and basic care measures need professional attention. If your pain is so severe that it's disrupting your sleep or preventing you from doing normal daily activities, don't wait. Get it checked out. Also, if you notice any changes in the position of your toes, for example, if a toe starts to drift towards your big toe, or if it starts to curl up, that's a sign the supporting structures in your foot may be damaged and needs some immediate attention. Here's something that many people don't realize. Ball of foot pain rarely gets better on its own if the underlying cause isn't addressed. In fact, it often gets progressively worse. What starts as a minor annoyance can develop into a condition that significantly impacts your quality of life and may eventually require surgical treatment. The key is early intervention. The sooner we can identify what's causing your pain and start appropriate treatment, the better your outcome will be. Many conditions that would require surgery if left untreated can be managed very effectively with conservative care and regenerative treatments when caught early. In my practice, I use a combination of physical examination, diagnostic imaging when necessary, and sometimes diagnostic injections to pinpoint exactly what's causing your pain. Once we know the specific diagnosis, we can develop a targeted treatment plan that addresses not just your symptoms, but the underlying cause of your symptoms. This might include custom orthotics to redistribute pressure and correct biomechanical problems. It can involve specific exercises to strengthen weak muscles or stretch tight ones. We might use advanced regenerative treatments like shockwave therapy, PRP injections, or laser therapy to promote natural healing and reduce inflammation. The point is, there are many effective treatment options available, but the first step is getting an accurate diagnosis. I also want to emphasize that ball of foot pain is not something you have to live with. I've had patients tell me they thought their pain was just a normal part of aging and they assumed nothing could be done about it. That simply is not true. With proper diagnosis and treatment, including these newer regenerative therapies, the vast majority of people with ball of foot pain can return to their normal activities without discomfort. As we wrap up this first module in our Ball of Foot 101 series, I want you to remember that pain is your body's way of asking for help. Don't ignore it, and don't assume it'll just go away on its own. The sooner you address it, the easier it will be to treat. In our next module, we'll dive deep into Morton's neuroma, one of the most commonly misdiagnosed causes of ball of foot pain. We'll discuss how to tell if you have a neuroma versus other conditions, and I'll share the most effective treatment options available, including the latest regenerative therapies. If you found this video helpful, please take a moment to like it, comment below with any questions you might have, and share on social media to help others who might be struggling with similar pain. Be sure to hit the subscribe button so you won't miss the next video in this series. Don't forget to download your free copy of my comprehensive guide to ball of foot pain at www.balloffootbook.com. It goes into even more detail about everything we've discussed today and includes information about treatment options we didn't have time to cover. If you're currently experiencing ball of foot pain and want to get to the root cause before it gets worse, I encourage you to schedule an appointment. The link to request an appointment is in the description below. Remember, early intervention is key to preventing minor problems from becoming major ones. Thanks so much for watching, and have a great day.